Good morning.
Very intense. Good morning, Donna.
We have now hit the said hour, so I will kick us off. Good morning to our audience in Latin America, and good morning, afternoon, or evening to those joining us from elsewhere. We have already 24 attendees on top of the team and the panelists, so I think it's a good time to start, and I'm sure it will continue trickling in. We are recording this session today, so we can share it with more colleagues and the wider global health community later on. So nothing will be lost. I'm really thrilled to welcome everyone to this discussion about the challenges and opportunity for using data and analytics to help with pandemic preparedness. This is very much the business of the Trinity Challenge. This is very much the vision that Dame Sally Davies brought to the Trinity Challenge Coalition and to founding the global charity that we are based in the UK, but really working globally. But today we want to go beyond that mission and really anchor the debate in what has been happening in Brazil and in the rest of Latin America, learning from Fiocruz, learning from IHME, both of whom are members and partners of the Trinity Challenge from the beginning, and learning from CNPq and Dr. Evaldo Vilela. So I will very briefly introduce myself. I'm the CEO of the Trinity Challenge at the moment. I'm a lawyer by background with a career in the civil service. And I worked on public health, mostly on antimicrobial resistance, also on a project that had been dreamt by Dame Sally, who is with us today and has since then, since being Chief Medical Officer in the UK in 2011, has now become the UK Special Envoy on AMR. So there's a thread on AMR, and I'm sure we will come back to this at some point today. So that's me. I'm very happy to be hosting you today as the Trinity Challenge CEO and hosting the conversation. Sally, I think you had your hand up, or was it just a wave?
No, sorry.
Okay, super. So that's enough about me, and then Sally will tell you more about the Trinity Challenge shortly. Let me say a little bit about our panelists. So I suspect they don't need an introduction for this audience. Nisia Trindade Lima, you are the president of Fiocruz and the first woman to chair the institutions in the 121 years of history of Fiocruz. You've been at the forefront of the COVID-19 pandemic response in Brazil, and I really can't wait to hear more about your work on vaccine therapeutics, diagnostic, and the whole approach to the response. And asking you lots of questions on, the role of data and analytics and why you think that's important in that context. You are a teacher, a sociologist, and a civil servant. You have been for 3 decades, and you're a member of the Brazilian Academy of Science. Rafael Lozano, you are a professor of health metric science at the University of Washington, and you also represent another one of our founding members in the Trinity Challenge, because of course you're the General Director of Health Information. Sorry, you're Director of Health System at IHME, who have been part and parcel of the journey of the Trinity Challenge since we've started. So again, I really can't wait to hear your reflections on the past difficult year and a half from the work you've done out of there. Dr. Evaldo Vilela, you join us from CNPq. We're really lucky to have you here, bringing the different background that you have from your research in the agricultural sector and being the president of CNPq, which is the National Council for Scientific and Technological Development, for those of us in the audience who are not familiar with the landscape in Brazil. You used to be the president of the Minas Gerais State Science and Technology Foundation, and you bring 30 years of working in science and innovation. So really thrilled to have this panel with us today. I will run a conversation between us of around 30-35 minutes, but then I'm really looking forward to an interactive Q&A with the audience, which the numbers are going up and up. So don't hesitate, please, to start about putting comments and questions in the chat function. Even during the first 30 minutes, some helpers in the team will help us sort through the question and jump onto the best ones from the beginning. And then I'll try and continue organizing it as a spontaneous and interactive conversation as we can for the second half of today. But let me pause here and turn to Sally first. Dame Sally, can you give us some background on the Trinity Challenge for those amongst the audience who don't know us yet? What is it and how did you start it?
Thank you very much, Hala. Thank you for setting this up with Nisia. It's really great to be talking to people in Latin America. And Hala and I visited Fiocruz a few years ago. I also visited Minas Gerais too in my time. So wonderful country. I launched the Trinity Challenge in September 2020 because we wanted to bring together the world's best thinkers and doers around the issues of better predicting, preventing, and managing pandemics. In the middle of 2019, the COVID-19, I'd realized we can and must catalyze new ideas, novel approaches, and innovative tools, and ensure that all people everywhere are free from the shadow of infectious diseases. So what I saw was that we needed a collision between public health and data science, and that we needed to bring in a lot of issues like behavioral science and mobility and attitudes, vaccine hesitancy, all of that. And while others were talking, we thought we should really move forward with some action. So now our Trinity Challenge, which is really a collaboration run as a charity, uniquely brings together academics, NGOs, and private sector organizations whose data and skills collectively do hold those keys to deep improvements in global health. We've got more than 40 member organizations from across academia. As you heard, Fiocruz, IHME, they come from social delivery and business too, and we're joined today by a couple. We're using this collision, as I've called it, of data science and public health to accelerate progress, and we're working in three big ways. The first is a public challenge for anyone from anywhere to participate. We collected a prize fund, which can incentivize, reward, and catalyze the best ideas from across sectors and countries. And the focus is on practical, scalable solutions that can identify, respond to, or recover from health emergencies in effective, novel ways and can be future global goods. Do you know we've had 340 applications from 61 countries? People have responded amazingly. Secondly, we've innovated some amazing collaborations across our membership between private, public and social sector, surfacing the role of data science, analytics, tools to address the tough questions that we think matter. And that's nurturing a unique environment for the exchange of ideas, perspectives, and experiences, which then feeds through into our third work stream, which is about the data ecosystem. How can we help our stakeholders, our members and others share data for value while protecting the privacy of individuals at the same time? And we've been working with a coalition of partners about that. So that's our setup and the working model of the Trinity Challenge. As I said, we had 340 applications from 61 countries. We've now got 16 finalists. Our wonderful judging panel are now working to reduce that to a fundable number. They all look great to me. And they're an impressive mix from geographies, organizations, and approaches, but all harnessing that power of data analytics, and true innovation to help the world be better equipped to handle disease outbreaks. And of course, addressing many of the problems we can see now during COVID-19. So can I ask you, if you want to learn more, to visit our website, thetrinitychallenge.org, and join us as well at the inaugural ceremony on June the 25th to hear about the winners. You can hear from our judges, you can network with the teams and other people who will be there. Back to you, Hala.
Thank you, Sally. That's fantastic. And I do hope many of our audience check out the website and the work we've done. You've described really well what we're doing. Can I ask you a bit more about your personal motivation at the beginning of the pandemic and why you thought it was something that was special and needed? Of all the things that you could do, why this focus on data and analytics?
Thank you, Hala. Well, I used to be the chief medical officer for England and the chief medical advisor to the UK government. And it was clear to me that as we go forward, we've got to bring data science in effectively. And we've got to use them for public health, and that it is about data that it isn't just public health data that governments or health systems might have. What they do have isn't always as good as it needs to be either. I mean, we know at the beginning of the pandemic, we didn't have enough data. It was very difficult to get at. It wasn't interoperable, massive challenge. And that meant that health systems and governments, clinicians, everyone was working rather blind, trying to work out what needed doing, giving advice without the most up-to-date data, and not able to shift policy in real time. And so we really need to find ways to use technology and data to help everyone, not just the rich countries too. And that takes me back to what we've seen in a very big way in COVID-19, though it's there with TB, malaria, and so much else, that outbreaks, epidemics, and pandemics don't impact people equally. And that is wrong. And we need the data to try and help these people and prevent it as we go forwards. I guess this resonates with much of our audience here. After all, Latin America has been disproportionately affected by COVID-19, with just over 8% of the population, yet you've seen around 25% of deaths from COVID-19. And as in every country, loss of livelihood, some very difficult socioeconomic implications for people in the region. So this emphasis that I have on inequalities worries me. And then finally, I would say that we don't understand enough the behavioral aspects for the drivers of outbreaks, epidemics and pandemics, and the response to it, whether these are emerging, re-emerging, or have always been there. They all start in the community. And that's very critical for Latin America, South America, just as it is in Africa, India, and Britain, where I'm standing at the moment. We need to understand these behavioral issues better. So those were the drivers to push me to undertake all this work. Thanks, Hala.
Thank you, Sally. Nisia, I'm going to turn to you and ask a bit of a similar question around, first, the role of Fiocruz, because some in the audience might not be as familiar with the work that Fiocruz does. And then what drove you to partner with the Trinity Challenge and to focus some resources and attention on there? My reflection has been that we have built partnerships with the Trinity Challenge and in other places during the COVID pandemic that are not on the traditional model. People have acted faster, have reached out to partners that they wouldn't necessarily work with normally, and have used sort of ways of organizing things that is a bit different, including the challenge, for instance, which is this prize competition that we launched. Really interested to hear from your perspective what was attractive and what has worked for you in terms of new ways of working during the pandemic.
Thank you, Hala. It's a pleasure to share this panel with Sally, Evaldo Vilela, and Rafael Lozano, and also with my Brazilian colleagues from Fiocruz, Manoel Barral, and Luis Augusto Galvão. Well, the Oswaldo Cruz Foundation, Fiocruz, is the important research and development institution in science and technology in health in Brazil and also in Latin America. It's linked to the Brazilian Ministry of Health and the aim is to promote health and social development, generate and disseminate scientific and technological knowledge. So the problem of data and the integration, the use of data is very important for the Brazilian health system, and it's very important in according to Fiocruz perspective. We develop research in all fields of knowledge relevant to health, from the biomedical to the social sciences. We offer several training courses from health technicians to PhD programs. We carry out surveillance activities and manufacture vaccines, diagnostic tests, and medicines for the Brazilian health system. So the production and the access, both are terms very important for our activity. Regarding to the COVID-19 pandemic, we have an agreement with the pharmaceutical company AstraZeneca, and we have a manufacturer over 50 million doses the vaccine, and they are now implementing a technological transference for the COVID-19 vaccine originally developed by the University of Oxford. We are conducting the necessary adaptations of our plants to incorporation now the production of APIs, the drug substance, so as to become self-sufficient in all process phases by the second semester of this year. So I think that's a good marker, an important market for the local production in Brazil and for the Latin America. Fiocruz participates in many networks of institutions, researchers and knowledge, and contributed to remarkable achievements such as the availability of effective and safe tests and treatments. Besides this, I think that the information and big data is a very important aim for our activity. Nowadays, I can speak about this after. We joined the Trinity Challenge Coalition as a way to promote and continue collaborate in the advancing knowledge globally, which is part of our mission as a strategic institution of the Brazilian state. This mission is to produce, disseminate, and share knowledge and technology aimed at strengthening and consolidating the Brazilian unified health system, and as the same way contributing to the promotion of health and quality of life of Brazilian population. We find the innovative approach of the Trinity Challenge as an opportunity for Fiocruz and the other research institutions from Brazil and Latin America to interact and collaborate to promote and improve data use and the analytics aimed to understand human and social behavior and health emergency response. Health emergency is one of the most topics in our agenda now. We look forward to continuing to participate in defining this new global health challenge, facilitating, collaborating among coalition members, and promoting analytics and the learning ecosystem for global public health.
Thank you very much, Nisia, and it's so encouraging to hear about the self-sufficiency that you're reaching, and even the production of the APIs, which is a key development. So congratulations. I can't imagine how difficult the past year must have been, you know, with the pandemic and the political situation and everything that we're all living in each of our countries. On that point of charting a way, each country has been different, each society is different. And yet we've all lived through this global pandemic in a way that has interconnected the world, maybe more than ever before. Do you have reflection on how Brazil was different, or things that went better or things that changed for the best, and opportunities that came out of the experience of Brazil to actually learn for the future in a way that is, can give us hope actually on amongst the difficulties that we've all lived?
Yes, well, Brazil is, and I think that the same point I can make about Latin America is a very unequal country. I think that's the first topic I'd like to focus. And that is clearly visible during the pandemics. Brazil is one of the most affected countries in the world and occupies today the second position number of deaths, unfortunately. Inequity causes a disproportional effect in the population in vulnerable situations. We also had problems related to coordination of measures in all levels of government. The surveillance, especially testing for COVID-19 and subsequent control measures, were fragile since the beginning of pandemics. So I think that the second point is testing for epidemiological control, and that is one of the failures in Brazil, I think very important. Now we are increasing the vaccination, but the reaching is not as fast as we need. So one point about the different response of and the results of the different response in front of pandemic is that some countries can overcome this difficult situation faster than others. So we have not only different response, but different results of the pandemic. I think that is the point that I'm very worried about it now. One point important about Brazil is that we have a universal health system. The Brazilian health system is a welfare conceived system, but all these capacities could not be well organized and implemented in face of pandemic. For instance, we couldn't use so well as you could the primary health care. And I think that's a very important point to think about the future, to think about the next possible emergencies. I would like also to mention an approach developed at Fiocruz in the last decades, which conceives health as development, understanding the concept of a health economic industrial complex. This concept shows that production, science, technology, and local innovation bases are essential to give economic sustainability to the health systems, also favoring global cooperation guided by the solidarity exchange of technologies. So I think that's the third point I would like to emphasize. And a fourth point is data and the analytical analysis will be vital to understanding the dynamics of the process and make it better to establish the best public policies and institutional arrangements to respond or even avoid the next health crisis. I think that these are the most important points in my perspective. Thank you.
Thank you very much. That is very comprehensive and gives us a lot of avenues to continue exploring. And it's clear already from what you're saying how much data matters for the economics and the supply and demand management, for the behavioral understanding, and even for the social and economic understanding of the impact. I'd like to turn to Rafael, who, you know, his world, your world, Rafael, is data. And ask you a little bit, like for Sally and Nisia, first, tell us the story of your pandemic and how, you know, how did it happen? What did you do at the beginning? What are the main things that you remember doing in your role at IHME and at the University of Washington? And then some reflections on what does it say about the future? What bridges, what lessons have we learned during the pandemic that you think will be relevant? Rafael, I think you're on mute. Yeah, here you go.
Thank you, Hala. Thank you very much for giving me the floor. And thank you very much, all of you, for inviting me to join this important panel. The Trinity Challenge is a quite important and interest coalition, global coalition that we need to, in some way, support in different angles. Let me just do a small clarification. IHME is an acronym, and we live in the acronym time. It's the Institute for Health Metrics and Evaluation. We are living in the University of Washington in the Department of Health Metric Science in the School of Medicine. Having said that, it's very important to consider that the Institute of Health Metrics and Evaluation also has the diversity of the world. And I have the honor to be the first Latin from our community in this area. But now we grow and we have faculties, we have professors, we have researchers, students, and we have a big network of collaborators in IHME. We started the work in the pandemic in February 2020. Don't forget that Seattle presented the first case in the US coming from Wuhan. And then we started working at home. It is the hospital of the university asked us, can you help us trying to see which is going to be the demand of beds and ventilators for the future? And we started working in our projections in a very domestic way, learning. And then we moved to the state, different areas of the state. Then we moved to the 50 states of the country. Then we moved to Europe, Latin America, and then we have 160 countries in our estimates, and we are working in all the world. So that's the way that we are doing. It's easy to say, but every week we update our projections, and our scenarios are considered in different areas: journalists, governments, international agencies, and population in general. Let me express my reflection, because we are living in the age of the dataism. In this time, the data is a religion, and the algorithms are the one who oriented population to make decisions. COVID is not the first pandemic in the digital age, but it's the most digital of all the pandemics that we have experienced. We are facing paradox and contradictions. And in the one hand, we can know how many positive cases there are in the world in a given time, but we cannot know how many of them are asymptomatic, or much less to follow the contacts. We can know how many people with COVID get complicated and go to the hospital, but we don't know how many of those who discharge from the hospital and survive with disability or long COVID term. We have an accurate record of direct mortality generated by COVID-19, and serious efforts are being to know indirect deaths, but according with IHME calculations in the Americans, 1.7 more deaths than reported we have. That includes the best impact. We learned a lot in this pandemic, and the main lessons come in two components: the lack of leadership of too many politicians, and a big scientific community sharing data. experiences, and knowledge. There is no precedent in the story of science in which so much knowledge has been produced in such a short time. However, despite of this effort and technological development, we have not managed to reverse the idea that we are rich in data and poor in information. The analytical component is a missing piece before the pragmatism of politicians. The language of health statistics and economics cannot convey the magnitude of the disruption for COVID that has caused in the families and the lives of population. People are crying their loss to lose people, and those with long-term sequelae from the disabled continue suffering. Statistics are not to capture that. We need to also incorporate more in that narrative. And related with the inequalities, as always unfortunately happen, those who had the least before the pandemic had even less now. And that is not fair, and we need to decrease that inequalities using an information and using encouraging people to defend the human rights. People living in the poorest countries are going to be the last in the vaccination queue. I will stop here and ask if in some moment the audience can go and visit our webpage. You can see the details of the information. This is not my job. I'm just one of the 50 people that produce these projections full-time working, but it's an honor to be representing my institution. Thank you, Hala.
Fantastic. Thanks very much, Rafael. And I don't know if you have examples now or maybe later when we get into the question and answers around, what are these good, interesting examples where you worked with others who are the analysts and the behavioral scientists and maybe the sociology people or economists who did bring the data to life more, because that's a point that you've made, that the data on its own isn't enough, and it needs the analysis on top. And I'm really interested in exploring good examples of when that has happened in a way that wasn't there before.
Well, before we didn't have this kind of international repositories. This is a new thing from the pandemic. Our wall of data, Johns Hopkins. We as an institution are extracting data from 57 countries, and some of them at subnational level. For instance, in Latin America, we get data directly from the ministers of health websites for almost all the countries. And very detailed information from Brazil, Mexico, Colombia, Peru, Argentina, Ecuador, Costa Rica, Panama, which is kind of behavior, accountability about the pandemic, better management. We are not satisfied with information than the governments, and we criticize a lot about the quality. However, I can recognize the example of Peru and Ecuador, the transparency of excess of mortality. I can recognize Uruguay monitoring cases in a very individual situation. Chile doing a big effort to test people. Brazil putting a lot of effort in specific studies that really give us information for the rest of the world. So there are very, very good examples in the region, but we are not totally with all satisfaction. We need to be prepared for the next pandemic, and we need to encourage countries to invest more. But maybe if I have chance to other participation, I can give some recommendations for the future. Over.
Great, thank you. And let me bring Evaldo at this point, because Evaldo, you have a really great balcony view, oversight of science and technology across the board, not just health. And from CMPQ, you have led some interesting initiatives around, better access and use of data. So again, I would love to hear your story of the past year and how it felt for you as as a person and for CNPq, and then thoughts on lessons learned and trends for the future.
Well, let me start with the last part, because I believe that countries should invest more in data collection and data sharing. I think the investment is not enough and is not very well oriented. We need to build local capacity, not only in the physical side, also on the human resources. I mean, this goes beyond the hardware and software. This is matter of humanware. And the main problem that we have is how we can fit all of these needs with the capability of each of the countries. It's important to have these international alliances, but also is quite important to build local capacity. We need to facilitate a multidisciplinary and multidisciplinary approach. And something that worries us is that in so many countries, there is no integration about the public and private sector. Too many countries also produce information in the public area and less in the private. When there is a big component, and governments should encourage more the private participation in these regards, investing and also sharing information. I like to also encourage to disseminate databases with individual records. It's very common that governments produce percentage aggregated data. That is not useful at this time of the development. Also, to incorporate the non-structured data from the social network. That they are doing a great job. Facebook, Google, a big surveys around the world that we can integrate it in some way that is necessary to do, respecting the privacy of people, but also taking in consideration the richnesses of that information. The future in the big data is not only the structured data from the government. It's necessary to integrate, and we have a lot of data scientists that we can really encourage. The other component is accountability. It's not only epidata. Epidata is a piece, but this pandemic and in Brazil had a big effort with a society proposal, 9 different dimensions of the pandemic, and they also is to account about what is the financial, how much the government that is spending. We don't know, and that's important to understand, and also about human resources. And finally, tracking vaccines. It is the information about vaccines is just how much the countries are losing the opportunity to receive vaccines, and how much people are going with the hope that this is going to change the world. But we don't know age, we don't know sex, we don't know negative reactions, we don't know what is the market, the supply side, we just know the demand side. So too many answers that need to be, too many questions that need to be answered in that front. I stop here because I want to pass the floor to other panelists. Thank you very much, Hala.
Thank you, Rafael. Evaldo, over to you. And from your point of view on CNPq and possibly on the collaboration with private sector companies, which is something that we really think very hard about in the Trinity Challenge.
Thank you, Hala. It's a pleasure to be here with you and all our panelists. And my congratulations for this initiative and to the Trinity Challenge and for the invitation. Well, CNPq is the main agency for finance research in Brazil in all areas. It's a federal agency. And we are now in our 70-year anniversary. So we are celebrating this year. It's a longer contribution to the science in Brazil and also for the development, economic and social development in Brazil. As we finance research in all areas of knowledge. We also have good contribution in health research financing with very, very near collaboration with Fiocruz and the Minister of Science, Technology and Innovation, and also the Minister of Health. CNPq is already engaged in several actions that represent advances in the form of research funding, having incorporated elements of support to open science in its lines of action. An example of our effort is together with the Brazilian Institute of Information in Science and Technology. We work together to establish a network of open research data repositories with the construction of the LATS data, as well as the construction of the National Consortium for Open Science, what we call Consciência, both to be released soon. Another related action is the support for the Cielo program, our scientific electronic library online, and the Oasis BR portal, which present scientific publications in open access and full text. Oasis portal, communicating with the international portals of Latin American referencia, and also to Open Air, the European Union, promoting Brazilian science abroad. An action that deserves to be highlighted is the promotion of the creation of research networks with public funding of projects oriented to a specific mission carried out by the CNPq through the funding of National Institutes of Science and Technology, what we call INCTs, 15 of them in the health area. Okay.
Thank you very much, Evaldo. So clearly there's been a focus on putting money fast behind the kind of health data that's needed in the pandemic context. Have you seen also different ways of partnering with partners that you wouldn't maybe have worked with before the pandemic, or ways to bring in private sector or social individual crowdsourced information in terms of data in a way that wasn't the case before?
Yeah, that's just a very, it's a challenge for us to go for the private fundings, but it's increasing the necessity, and also the private sector is always more keen in help us with the finance of research. It's the case of this, as we are trying to change the culture we have in Brazil, as we finance projects, we have the possibility to change the behavior of researchers in terms of cultural aspects. As we have for a long time, we incentivize the researchers to close the data because the possibility of patents. So now we are reversing this and say that open access, open data is very important. So the private sector also is very keen in help us to encourage the researchers to adopt the data access, data. As for instance, we are now trying to incentivize the paper data, for instance, as you have in Europe. the incentives for the researchers to publish paper data. We are now trying to valorize this opportunity in Brazil so that the researchers can have some better score for grants if they being use the latest date, for instance, okay?
Great. Thank you very much, Evaldo. And we're starting to get questions from the audience, which is great. And I would encourage everyone to add some questions, please, on the Q&A or the chat. This is working well. But before I ask the first question from the audience, I'd like to go back to Nísia and Manoel Barral briefly, maybe to tell us about your specific initiative on data and the observatory, for instance. Over to you.
Yes, thank you. Yes, now it's okay. Sorry, but the problem of the virtual, I forgot. Well, Fiocruz is an important national and international center to generate analysis and communicate that data and knowledge. We approved in 2016 specific institutional policy for open access of our scientific production, and recently we approved some directions for open science. Now, during the COVID-19 pandemic, we organized a COVID-19 Fiocruz Observatory to produce information for action in the different fields that I had mentioned before. And I think that we have a special center that is the CIDAX, Center for Integration of Data and Knowledge for Health, and Barral could explain better about this center. Manoel Barral, I could introduce, I think, is an important Brazilian immunologist. He's researched at Fiocruz, Bahia, in northeast of Brazil, and with a very well-known career in terms of management of research, science, and now dedicated to the data process and data integration and its use for surveillance in Brazil. Please, Barral.
Hello, good morning, everybody. And it's really a pleasure to be in this panel. I mean, it's really fantastic work that people are doing in terms of putting data on the center of this debate in COVID. And just to add some information, like Nisia mentioned, that Fiocruz has several initiatives on data, not only related to COVID before that. And it's really necessary because Fiocruz is spread around several states in Brazil. So it's really necessary to have a strong position on this sharing of data and common use of data. And in this case, specifically, the center that Nísia mentioned, the CIDAX, is really a center for integration of data important to science, not only bona fide data science. And so it's really, it's being contributed to evaluation of health policies in Brazil. There are several publications on that. And more recently, pushed in part by COVID, it's also going into genomics, data on genomics and other aspects of electronic health records in order really to integrate even more the information. But of course, this is not the only initiative in Fiocruz on that. There are several initiatives on data and related to COVID in Fiocruz. And I would like to highlight the one that is
No, I think that his connection
Just broke at the key moment.
Yes. Yes. Now, please, Hala, I think that's important just to add that before COVID and since the 1980s, you have a unity dedicated to information communication at Fiocruz with a PhD course for these topics, information communication. So I think that is not recent policy at Fiocruz. I think that is important to mention.
No, and it feels like it when I've been working with the team and with Manuel and Guto, it really feels like it's a place that has been thinking for a long time about both the availability of data, the use of data, but also what Sally was talking about earlier, the collision between different types of data, scientific data, but also with social and economic data and behavioral data, which is why it's so important to bring all this knowledge to the fore. And being an optimist, I keep thinking that COVID has, wreaked havoc in so many of our lives and families everywhere. But I also want to think that there is something that we will learn in terms of going faster and better in how we use all this knowledge and this thinking. Now people will take it really seriously, and both private sector companies in the way that Rafael was talking about will actually, want to work with the public and charitable actors to bring the data to use. And I think that's why CDAX and the observatory is such an interesting example for us. But I'm probably talking too much now, and I have questions from the panelists. Manuel, if and when you come back, please make a sign or drop me a line and I'll bring you in. So
here he is.
There he is, Manuel, back to you.
Well, sorry, I was with contact all the time, and then it dropped just at this point. And I guess I was explaining about CDAX. I don't know if you got that. But and then I added that is, of course, it's not the only effort in Fiocruz. And I mentioned both the program in LNCC in where the scientific computing, that is a long-standing program that contributes a lot and had a major aspect with in modeling several aspects of the pandemic in Brazil and helped a lot in terms of planning activities, not only of Fiocruz. So it's expanding, and I guess already with some impact, visible impact on health that is getting more support in terms of the health authorities are really seeing the impact of good analysis of data in terms of decision making. Okay, thank you.
Great, thank you, Manuel. So we've had several questions from the audience around open science, and it's a concept that's incredibly important and being pushed at the moment. I'm sure many people understand and hear different things when we talk about open science. The question has been asked a couple of times of the challenge. Does the challenge pursue open science? So I'll ask Sally to come in to explain her vision around two things that are very important for us and really are foundational to the concept of open science. One is we're calling for global public goods. So what comes out of the challenge need to serve everyone. And then we're looking for ideas from anyone, anywhere. Sally, these are your ideas and the principles you put into the challenge from the beginning. Do you want to say a bit more about these?
Thank you. So coming from Britain, of course, we believe in open science. So we need open access for publications. We want openness about data, but we have to preserve the privacy of individuals. So you probably know we do share all the genomic data and we show the regions and areas, but you can't tie the genomic data to other people. And that kind of carries through into the health and behavioral data, that we must preserve their privacy. So some is available on an anonymized level, but much more is available to work on. And then the data, the kind of accumulated data is shown afterwards. And where we've had some very interesting debates are with, of course, the private sector partners of the challenge, who hold a lot of data and feel, and not unreasonably, that their contract with their users was for privacy. So again, they're allowing access to the data for analysis and putting into groups, but it's not going to lose its privacy. We won't be able to track back to individuals. Clearly, without that, the privacy preserving, but the openness, we wouldn't deliver the global goods that we set out to do. So very much in favor, but we have to recognize the privacy rights of the public. Thank you.
Thank you, Sally. And as part of our work, we've come across a number of technologies that allow the kind of aggregation with anonymization that you're describing from a technical point of view. I want to turn to Rafael and ask if, you know, these big leaps of data and dashboards that the Institute has helped set up worldwide, how have you dealt with this question of accessing data in a way that preserves privacy and trust?
Thank you, Hala. I just cannot resist the make a comment, and maybe it's a cultural or linguistic problem that I have about the concept of open science, because science by definition is open. So if we need to open the concept, it's because there is something close. And if there is something close and it's hidden, that means that we have to be transparent. So anyway, I totally support this idea that Sally presented about how to access to science. But anyway, maybe it's my culture and my bias way to understand. And I want to incorporate, besides the concepts that Sally mentioned, universal connectivity, interoperability, and always put in the top the human rights. Now, when you say access, this is a very, very strong challenge for us, because it is, we have access for that universe with access. So we have in many places, even in rich countries, lack of connectivity. That means that the access is delayed, is low, not enough to download all the information. However, we can say that we are very proud about the number of hits, the number of users, many from developing or poor settings, but the majority for rich countries. So in some way, when we open this data, in some way we are reproducing and encouraging inequalities, and we need to go in the direction to encourage people to facilitate the access. That's why the principle of universal connectivity is quite important. I didn't answer specifically, but I'm hope and I can share the statistics about the hits, because it's a quite challenge. And finally say that this is a long story coming from Florence Nightingale. Politicians prefer visualization than numbers. Politicians read easily visualization than numbers. And I'm talking about these important women that create a big challenge to the statistics in the Victorian, English Victorian. So we have to repeat that. We need to continue with the visualization in order to facilitate the access to the information. Over.
Thank you, Rafael. And what a wonderful way to close this discussion. And of course, the Trinity Challenge logo is based on Florence Nightingale's visualization of the sort of death caused by war and death caused by illness and conditions during the Crimean War. And as a policy maker personally and a civil servant, I really lived every day how much to translate good science and good principles into action in politics and with the public, communicating them in a way that is understandable and in a way that is visual when possible is so important. And I think that's actually one of the things that Sally did best as the chief medical officer in the UK, was translating to people and to politicians. And we probably all have a responsibility to do that work, you know, in the global health community, and not talk to ourselves, but really talk to others in a way that is understood, so our messages can land. It's incredible how quickly time goes when you have 4 as interesting people as you guys to host. So a huge thank you to you, Rafael, to Evaldo, and of course to Nisia and Sally for making this happen in the first place. This is only the beginning. Let's continue. And before I close, I just wanted to say a huge thank you to the team who put this together. You will recognize yourself, but Guto and Manoel, we couldn't have done this without you. And Lizzie and Saba, you pulled an amazing amount of work in very short time. So thank you very much. And to respond to everyone who's worried about accessibility of this conversation, we will publish the video and it will have closed caption and they will be translated because of course we want it to be as accessible as possible to the public. Thank you very much. Have a great day for those of you who are starting your day. Bye-bye.